It's a huge privilege and great honor to welcome two of our very special and distinguished guests for today's panel. So I'll just go through a brief introduction to the panel before we jump into the discussion, which is going to be very interesting. So we have Dr. Anurag Agarwal. He's the director at CSIR Institute of Genomics and Integrative Biology. He's one of the country's most brilliant scientists, a remarkable visionary leader, and a passionate mentor. So Dr. Anurag graduated in medicine from All India Institute of Medical Sciences and then went on to specialize into pulmonary disease and critical care at Baylor College of Medicine, and then did his PhD in physiology at Delhi University. So he was a faculty member at Baylor prior to joining IGIB, where he spearheaded and established a Center of Excellence on Translational Research in Asthma, Lung Disease, and CSIR program for effective application of health efforts through new age information technology. Of course, Dr. Anurag has been bestowed with numerous awards. He's a board member and fellow of many academic societies. So currently he serves on the board of very prestigious institutes within the country with huge impact, like Public Health Foundation of India, Lady Tata Memorial Trust, and institutes like CCMB, then Center for Brain Research, Indraprasth Institute of Information Technology. He's currently advisor to several startups and healthcare organizations. So, of course, many awards has been bestowed upon Dr. Agarwal. Name a few: US National Academy of Sciences, Swarna Jayanti, Shanti Sarup Bhatnagar, National Bioscience Award. He was also a recipient of the Wellcome Trust Senior Fellowship, Lady Tata Young Researcher Award. So Dr. Anurag is a passionate enthusiast on applications of AI and health data analytics to new frontiers of medicine, and how do they merge together and create that value today, what we would like healthcare to be. So my next panel is my ex-colleague and friend as well. So Ms. Nimisha Gupta, she's the co-founder of a tech company which looks into healthcare solutions called G-KnowMe. It's a precision medicine company, and they are committed to how to combine biological assays, diagnostics with informatics for better patient care. She's a computer scientist by training. She did her master's in computer science from Indian Institute of Science. And since then, she has been into building products and solutions, I think over 2 decades, and having focused into healthcare diagnostics, drug discovery, translational research, and business intelligence. So she's passionately motivated to how to empower patients with technology to enhance quality of health and assist patients with informed decisions. Her key interests are how to use artificial intelligence, natural language processing, natural language processing, and machine learning. Actually, we worked together till very recently on a very interesting program from Government of India, which was to do to how do we build quality and build scale for molecular diagnostics, and the emphasis was on SARS-CoV-2. And I think we did a wonderful job. I think when COVID started, the cost of a RT-PCR kit were 4,000, and today we are seeing at 500. And thanks to all the startup and the companies in India, which actually came up and stepped up, and they ramped up their capabilities, building that quality and capacity, which actually led to democratization of RT-PCR kit in India. So it's wonderful to have you both here for this very interesting discussion on a title, which I must thank Shushuvan for coming up with very interesting title called Healthcare Engineer, Solving for Access, Affordability, and Quality. So the question how do we disrupt this notion of iron triangle? That improvement in one of these dimensions will lead to decline in at least one of them. So can digital technologies and the advanced engineering tools be an answer to this? I personally feel that India is very rightly poised to actually leverage this opportunity of combining all these skill sets and the tools and really coming up with a quality healthcare system in the country. So with this context, it's with immense pleasure I invite Dr. Anurag to share his vision on the topic and does he think how we are progressing and what kind of opportunities lie for students and young entrepreneurs to contribute in this ecosystem. Over to you, Dr. Anurag.
Thank you so much, Mitali. As is usual for panel discussions, I prefer not to use slides so we can engage more. And so we can also take questions from anyone here as well as from the audience at any point. So we were to narrow the entire point down to three important questions. First, does healthcare need a major revamp? Second, can technology play a role in providing that revamp? And number three, would we consider redefining health itself as technology gets better? I would say the answers are yes, yes, and yes. And I'll defend each one of those three statements. If you look at access to healthcare, there is a very obvious problem. Universal healthcare 2030 is a 2030 goal for a very simple reason. Most people in this world do not have access to healthcare. The healthcare access, even for people who do have it, is, if you were to take feedback, is not often satisfactory and leaves much scope for improvement. So this brings us to the second question that I answered with a yes. Can technology help us? In the most immediate thing, you could ask, can technology lead to better access to healthcare? That's the simplest question one can answer at the essence of it. If you were to make no further improvements in healthcare, could you use digitalized world to give people access when they don't have access to actual doctors in person? We already saw the answer to that, didn't we, during the time of the COVID-19 pandemic. In fact, many things I will say today were tested during the COVID-19 pandemic. So in fact, that's something you can use as a guiding stone. Did it help during that time? And then comes the last point. If technology were to truly disrupt healthcare or health, would it look anything like what it is today? And that's the part I will spend more time on today, because the first two are relatively obvious. I think how we think of health itself will change away from disease to wellness as we can learn more and more. In medicine, everything has to have a label. If you can't measure it, you cannot label it. If you can measure it, but you cannot change it, there is no point in labeling it. So in medicine, we apply labels when two things are met. A, it's measurable. B, it is changeable. We have a great resistance to create labels for stuff we cannot change. And therein is where I say technology will change things, because technology will make more things measurable. So even wellness can be defined as multiple states in a continuum moving towards disease. And number two, it may provide solutions that allow you to go from lower levels of wellness to higher levels of wellness without ever touching the disease part. And that will be the other things. And when I heard about Nimisha working in precision medicine, I'm very sure that's an area she will agree with. So I think I will stop my initial few minutes here and allow it to go back for further discussion.
Thank you, Dr. Anurag. So I'll have a question for Nimisha now. So Nimisha, I think, yes, where Dr. Anurag left, that you are a founder of a precision medicine company. So could you enlighten us on some of the disruptive innovations in healthcare? And what is it so special when we design or build solutions for healthcare? It requires a higher rigor of development life cycle. We need to meet certain quality parameters, how robust it is, how precise it is, how accurate, because we cannot go wrong with any solution that we are targeting for a healthcare purpose. So over to you, Nimisha, to get your thoughts. And again, how do you think today's young talent, our students and young entrepreneurs can contribute here with their new ideas, new innovations, new energy?
Sure. Thanks, Mitali, and thanks, Dr. Anurag, for that perspective. So I would answer three parts to your question, Mitali. So first thing is where do I see the disruptive innovations today? And I'll start where Dr. Anurag stopped. So precisely, wellness is the first aspect of healthcare, and that's where I see one of the most number of disruptive innovations happening. So the wearable devices, right? The devices which are measuring your biometrics, the pulse rate, the oximeter, right at your hand, trying to get you monitor your health, monitor your fitness, trying to keep you away from falling sick without being in a clinic, right? Those measurements right there in your hand and adding to your personal profile, right? That's the first place where I see the technology that is disrupting healthcare. So the next phases of healthcare, as I see, are screening, diagnostics, treatment, and management. And each of these areas, so in my last 2 decades of applying technology to different aspects of healthcare, I'm very excited about each and every of these aspects being touched by the technology. So screening, one example of disruptive technology that comes to my mind is Niramai's thermal breast cancer screening technology, right? So breast cancer, one of the burning issues, right, all across the world. Screening should be easy. Screening should not be something like a mammogram, which is conducted in a hospital, not accessible to anyone, like Dr. Anurag mentioned, right? Accessibility is a problem, affordability is a problem, and even for people who can afford, right, invasiveness and the fact that it kind of exposes you to further risk, the radio side effects of mammography. So something like thermal imaging using the cutting edge artificial intelligence algorithms, bringing that, solving that particular issue and bringing that technology right in malls, right in the rural setups where a huge number of population can be screened is an example of disruptive technology. And while artificial intelligence and learning algorithms come to the mind first, there is a lot of other engineering technology involved in packaging these algorithms to a box, making all those chips that go inside, all the fabrication, the units, the detectors, and everything. It's not a single discipline. It is kind of cutting across a wide variety of engineering disciplines, and it's kind of disrupting the healthcare. So that's what I see in screening. Now coming to diagnostics, so Mitali, just like you mentioned, right, the INDX program and the COVID situation. So having very recently done that rat test at home, right, the miniaturized kind of sophisticated microfluidics to the chip to the biosensor to the accompanying end-to-end app. Another disruptive technology bringing diagnostics right at your hand, right to the hospital bed. And again, cuts across a lot of engineering and science disciplines, all the way trying to work out the material, the right disposable material, so that this kit is environment friendly also. Getting more into the diagnostics, one of my passion, digital pathology, radiology, teleradiology, and even the radiology image analysis, trying to remove the subjectivity out of diagnostics, kind of aiding the experts, right, with more decision making, not trying to remove a pathologist, not trying to replace a radiologist, but trying to aid these experts, bringing the data where they are, rather than mailing a pathology slide, right, to a pathologist. The person from the comfort of his home can provide the best kind of advice. That is another disruption that I have seen evolving over the last few years. Next gen sequencing, and I'm sure that is something that is very close to Dr. Anurag as well. I happen to be working for Strand Life Sciences actually for about 14 years, where we launched these diagnostic tests in India. personalizing medicine, making it precise, right? Looking at large scale of genetic markers. Uh, a diagnostic modality that is possible purely by the advances in technology on so many different fronts. Uh, Coming to treatment, targeted therapy, immunotherapies, I'm very intrigued by robotics surgery, the image guided robotic surgery. Again, bringing in automation, robotics, analysis, and everything together. And not to mention, actually not least, but another major area, electronic health records, the digital health powered by electronic health records, bringing data from all these sophisticated diagnostics together and kind of putting together the very efficient decision support systems, which is becoming possible. So precision medicine, right? One of the key drivers of precision medicine is when data from all of these places come together, and then it can be analyzed with all these sophisticated algorithms. So these are the I think a lot of, and the list goes on. If I talk every day, I read newspaper, I read a journal, I read about something that totally fascinates on how technology is kind of changing healthcare. So coming to the next part, so the regulation part. So while some of the algorithms, right, that power some of the healthcare technology are very similar to what are used in, let's say, Netflix recommendation of next movie, the same algorithm is kind of repurposed to provide you a kind of what is the next best medicine in this scenario. But the implications of using an algorithm or technology in healthcare are very serious, and I think that brings in the need for regulation and a lot of compliance guidelines. So while people, young entrepreneurs or people working in the field find this as hindrances, but these are just the guidelines. These are the principles which ensure that once you bring the technology to the market, it works the way you want it to work, and it doesn't cause any harm to the patient. Now, what can the students and young entrepreneurs do? Whatever is their discipline of interest, I'm sure if they will find a lot of applications actually to their skills. They have to just keep their mind open when in your next visit to the hospital, the next test you buy, the next time a friend tells you a story about what they're struggling with. There is scope everywhere, and you can actually make a difference in many different ways. So if you are interested in research, you can come up with a totally new technology that makes a change, but that's for a few a very little set of people, right? But more and more you can contribute to improving the quality, right? You can improve how to package a particular technology and make it accessible, like point of care. So there are small enhancements that you can think about that can make a difference, and there is a scope for everyone, and yeah. And anyone there, even the basic sciences, the physics, the mol bio, the biochemistry, everything is powering healthcare. So I'm really excited to be in these times.
Yeah,
thank you.
Thanks, Nimisha. And I think very wonderfully said that healthcare is a domain which needs the expertise from multiple disciplines. It's no longer just biology, medicine. You need to bring high-end computational engineering, physicists. So it's really, really exciting the way people can bring in novel innovation in this area. So my next question to Dr. Anurag, and as we have been watching the COVID pandemic, I think now over 2 years or more, so we also know that Team IGIB has been playing a major role in trying to help the country and how it should manage the surveillance efforts from genomics or from serology, and how informatics is brought into it. So, and we know Dr. Anurag has spearheaded all these, or relentlessly continues to spearhead all these initiatives. So can we hear from you? What were your highlight moments, and uh, how good you feel with the impact that was felt with your initiatives from IGIB?
Thank you. That's a really interesting question. And in fact, as a preface to my answer, let me take the one thing, Mitali, that you missed when you talked about how medicine is not about biology, healthcare is not about biology alone. So you mentioned many sciences, but you never mentioned any humanities.
Oh, sorry.
So the preface of my answer would be that if there is one learning from the COVID pandemic, it is that pandemics are not about science, they're about people. And people are not about science, they're about behavior. And behavior is determined by very important branches of humanities, particularly economics, psychology, and so on. So with that said, let's ask ourselves, what could science have done? And then let's see how we did that. So science, once the virus comes and the basic diagnostics are in place, you can of course get data regarding how many cases are happening. But you need to understand at level 1 how accurate such data is likely to be, and the various parameters that come out from it, how accurate they are likely to be. And then you need to relate them to the virus, to the host, and the context in which the virus-host interaction is occurring. So the easiest part for us at IGIB was, of course, the virus. You can sequence the virus, you can find out what mutations are occurring. The harder part is of giving a function to those mutations. So for example, when we started seeing the first mutations in what is now called Delta, you could see these mutations would have certain effects noted elsewhere in the world, and it might make the virus more threatening. And you could perhaps give a warning out saying that, look, a new variant is being seen, and we spoke to WHO, we spoke to everyone else. Same thing occurred in my capacity as the chair of the WHO viral evolution subgroup. When the Omicron sequences came in South Africa, you could read those sequences, you could make out antibodies will fail, immunity will go down, vaccines and previous infections will no longer protect as much, and there will be a surge of infections and reinfections again. So far, so good with science, very nice and very fulfilling when you're able to identify these things. Also gives you nice academic rewards in terms of publications. So, but what would you do with this information? The only thing you can do with this information is to get people to act upon it. And what could those actions be? Let's take them one by one. First action could be that people take protective measures which are not based on any particular vaccine or based on their prior infection, such as masks. And yet you see there's a complete failure on that. So you can indicate as much as you want regarding the importance of wearing masks. You would not be able to influence behavior without it. So that's the not so satisfying part of it. The second is you could say that, look, I know that so many doses don't work. Can we give additional doses? Will that help people? For that, you need data. And you can speak a lot in science about the need of data, but there has to be a way of generating the data. And the process of generating the data can occur in two modes. In one mode, you do a proper trial with a control group and a intervention group. You get the data in a high quality. You take a few months. But again, you can see that's not going to be particularly helpful. If you are expecting the entire thing to start in a month and your trial will take 2 months, then you can't rely on trial. But being scientists, you also can't say, let's do this without data. So all you can do is, you can do it the way Israel or UK do it. They start the intervention using the people who get the intervention later as the automatic control group and use mathematical adjustments for this going forward. And you need to know a lot about the people that you balance, because of what if the people who take the vaccine are different from the people who don't take the vaccine? And that brings new complexities. And the point I'm really trying to make at the end of this is, I think genomics was a simple part. Sequencing a virus actually is quite simple. It sounds tough, but it is not. Getting the system in place so that the samples come in time, the outputs go out in time, the impact of the output on interventions and behavior happens in time, the correct analysis occurs in complex real-world settings, equivalent to proper trials, are mathematical problems, epidemiological problems, which require inputs from every branch of science and very important humanities when it comes to behavior. So I'm going to stop here again. And I think everybody in this world who has an interest in these areas, and I'm going to borrow something from a previous talk by Ashish that I just happened to catch the end of, and has a passion about changing. And even if they don't have passion, they are simply good at it and keep at it, are able to do it. That will be enough. I'll stop there.
No, great, Dr. Anurag. Actually, very, very nicely put forward. Yes, which I missed is the human part and how that plays such an important role. While you may have all the toolkit with you, but if the human behavior is not tuned to the desired kind of practices, then again, it will not be successful. So thank you so much for bringing that into this discussion. So, so my next question is again to my second panelist, Nimisha. So, so maybe I think you did touch upon that, like what are the digital solutions and what are the precision diagnostics, precision medicine. Just to simplify it, if we take, say, a complex disease scenario like cancer, and the way it is treated today and the way it is diagnosed today, how can a digital intervention or engineering intervention change the whole scene where cancer becomes a more manageable disease rather than a disease how we see it today that, okay, if we are fortunate, we may have extended survival time, and if we are not, we may succumb. So over to you, Nimisha.
Yeah. Sure, Mitali. So yeah, most of my examples actually happen to be driven from oncology because I think that is the field that I've been for some time. And cancer being a complex disease, right? So right from the screening stage to the management. So as it has now become, it's more of a chronic disease with the advances in the treatments that are there. So it's no longer the end of life statement. So if managed right, if you have the right data, if you employ the right diagnostics to make the right decisions at the right time, and you make the treatment available to all, then cancer has become more of a chronic disease. But the nature is so that you need to keep track of what was done earlier, right? In order to make the right decisions now, you need to have a good understanding of what was done previously. So that's where the EHRs, the electronic health records, and in the course of treatment, there are diagnostic tests that are done across different labs. The treatment itself, because it is spread over the years, right? It mostly happens across different hospitals. So in order to apply the precision medicine or trying to individualize the treatment for a particular population, it is very important to know what are the kind of markers, different kind of markers, including the lifestyle markers of the patient. And that's where all these wearable devices and right keeping track of all the other kind of measurements for monitoring also come into play. So have digital health powered by a comprehensive electronic health record system, which is still the need of the country. So in our country, you will still find doctor's notes in a file. So there is all kind of scope for having a vernacular OCR kind of software which can translate this into the kind of information that can be used for making informed decisions. So that is one spectrum, and on the other spectrum are the cutting edge technologies like liquid biopsy kind of things coming into picture. So making some of the invasive management routines. So by the time the recurrence is detected, kind of in imaging or by and sometimes via surgery or the invasive biopsies, right? It is too late. So that again, the technologies like liquid biopsy, trying to do a blood test to monitor if there is a if the cancer has recurred, and, and trying to empower, so make it standard of care, trying to improve it to the extent. So the current way it is done, it is still quite costly, it's not available to all, but spending time and energy to make some of these technologies which are non-invasive and which can make the management of the patient easier, I think is again something where we can focus on. So, especially in chronic diseases like cancer and even kidney transplant, for example, right? Trying to detect a rejection by a test on the blood rather than waiting for a biopsy in the kidney. So these are all the kind of chronic diseases where right, early interventions via some of the smart monitoring and management kind of methods can help.
Yeah, thank you so much, Nimisha. Yes, and that's where we are heading, like how early we can diagnose, how we can predict, and then how better we can manage through biomarkers or certain signatures which may not require invasive procedures. So I think we'll see the day maybe in a decade's time where cancer becomes a manageable disease and no longer life-threatening as we see it today. So my next question to Dr. Anurag, and probably this is to do with the way medicine is progressing. So we are in an era of synthetic biology, where we are synthesizing, say, the proteins and monoclonal antibodies to start with. And we have multiple companies in India which has developed and has been manufacturing these recombinant proteins and monoclonal antibodies and trying to make it affordable and accessible for country like India. Now, the next new generation is moving into the cell and gene therapy. And we saw a wonderful example of the mRNA-based vaccine. I think this was the first time technology. And it so happened that COVID became an opportunity for this technology to prove itself. And how wonderful to see that, how fantastically successful the mRNA technology has been. So I think with the cell and gene therapy area, though we have huge success in treatment of hematological cancers and now being looked upon into neurological, autoimmune, but the challenge for us will be the cost. And how do we bring this expertise? Because this requires very high-end skills, again, a combination of multiple disciplines. So how do we create that ecosystem? And we can learn from other countries as well. We can take some of their best practices as well. Like, for example, in UK, they had a catapult approach, so that they had these specialized centers which people could access and use and then build their products. So, Dr. Anurag, how are you envisioning and how do you think India can leverage and how can it make it affordable as it did for bone marrow transplantation some many years back?
No, I think it's a fantastic point. I mean, this is clearly one of the frontiers of biomedicine. And frontiers tend to be expensive for a few reasons. I mean, A, the input costs are high, and B, the probability of returns is low. So in business, whenever your probability of returns is low and your input costs are high, then you would have to price it very, very high. So if you look at Zolgensma, the nucleotide inhibitor for spinal muscular atrophy, the costing of the drug is over $1 million, right? One shot therapy for a person born with SMA genetic disorder. And hopefully, since neurons don't really grow that much after birth, you may have a lifelong treatment, but the cost is over $1 million. So the question that has been in my mind as well has been, how do you create the equivalent of a Zolgensma type of a drug, which is gene therapy using everything else, at an affordable price point? And you really have to break it down into reducing the input costs and increasing the probability of success. So how to reduce the input costs? So expertise in India, the human capital, is of course significantly cheaper. And the concept of public good, where a certain amount of data or facilities are made available using public funds, is also critical. On This point, there are two things that we are able to do and two things we are not. On the human side, I think we are doing well. We are training more and more people with the relevant expertise, including sometimes bringing them back. And we are able to keep, reasonable living costs and salaries for such people. The second side, high-end public goods, like the Caterpillar program, that people are able to use, is far trickier. It is a large country, and there are multiple universities. Many people may have ideas they may want to test, and the government has tried a variety of programs to make equipment of high-end labs available to everyone at some degree of cost. But they have not been largely successful simply because the number of potential users is very, very high, and the number of such sites is very, very low. And we don't have usually the concept of a full-time operator of these high-end equipment who's always free to guide somebody who wants to use them. India is still largely student-driven, not technician-driven. And the students also keep on changing. So we need to have a fundamental change in structure, very much like the Caterpillar program that you talked about, if we are to do it well. I would argue that to leave it to the government as public good is also the other part where we are faulty. The idea of governments doing it as a public good is more relevant to very high income countries. India is an example of an advanced country with not very high income. So I think the private sector needs to come in to a large degree, and private universities and academia in particular need to shoulder a lot of this burden. And I think we can do it. And focus areas, of course, I think I spoke a long time on this one, but I will just come back to this. There is enough data now floating around for us to know India's key medical problems in which there would be a large market if a solution were to be found. India is amongst the most related parents possible in this world. So if you look at similarity between parents, which is a good index of how frequent genetic disease would be, relatedness between parents is the highest possible in many Indian subcommunities, far higher than Ashkenazi Jews or anybody else that we talk about in medical textbooks. So there's plenty of disease to be found. There is plenty of things to be treated. We just need the overall ecosystem to be put in place. I'll stop here.
Thank you so much, Dr. Anurag, for this wonderful insights. So I think there are a few questions and we probably have another 6 minutes. So I'll just run through the questions. The first one is, which is like the wearables are not affordable and often not accurate. So what do we do? How role of technology can play a role in this preventive healthcare when again access is an issue and accuracy is an issue? So maybe this question could go to Nimisha or?
Yeah, sure. So wearables, yes, wearables are not for accurate diagnosis as of now. The accuracy of wearables is in question, but the technology is continuously improving. And with more and more data points, with more and more data being collected, one does not have to look at a particular data point given out by a particular wearable. One has to look at associations, one has to look at other factors. So both things will happen. Things will not be looked in isolation, and wearables are not a substitute for not taking a medical advice. So the way we look at them, right? So these are not the parameters to be monitored on a hospital bed or when you have a serious condition. We are talking of this as a preventive measure, pointing out risk and all. So to that extent, wearables are good enough, and I'm sure with time, the technology will improve, and that's where the young entrepreneurs here can see the scope, right? So that is what is happening. The underlying algorithms running these right measurements and even the decisions are undergoing a fundamental change. They are changing from the black box algorithms to more explainable ones, which rather than giving a particular value, which are kind of giving pointers which can be used for decision making. So all of this is going to help two things. One, improve the quality of measurements that these wearables, right, produce, and the way what they output is used for making further decisions. So that's what I would say to that.
Thanks, Nimisha. I think I'll just combine the two questions for Dr. Anurag. And that is to do with, again, the point that he brought, the human interface. So the question is that if we start relying on AI for our health indicators, how do we plug in the empathy part that we get from our doctors? Like when we go, sometimes we feel very sick, but when we just see the doctor, we start feeling better. So your thoughts, Dr. Anurag? And
it's a wonderful question.
Yeah.
See, the placebo effect is a very well-known one. And if you look at any RCT, one group is getting the placebo medicine but is seeing the doctor. And on the other side is getting the real medicine and seeing the doctor. On the placebo side also, you see significant improvement of symptoms. And you could argue the patients don't really care about the signs. They just want relief of symptoms.
Yeah.
And an impressive doctor telling them that they are going to get better does a good job of getting their own brain to solve their own problems. And that is a desirable thing. Separating that from science now, the human touch is indeed extremely important to patients. And I do not see any possibility in time to come where you would have completely autonomous AI systems with no human whatsoever. My belief is that if doctors are relieved of some of the burdens of the things they do, they would find more time to be empathetic and develop the soft skills that are very much seen in many private practices, but not often seen in academic places. But that's not an exclusive thing. You will, in fact, find that the most successful practitioners are the ones with the soft skills. So that's a reality. But coming now further to a bit of the question, will any of this distract from the true business of innovation and the true business of making patients better? No, it shouldn't. It's a question of realization of what is it that you want out of every step that you do. And eventually, N of 1 trials, where you can innovate reliably on singular patients producing data for them, can be enabled not by less data, but by even more data. So it is large collections of poor quality data that are the challenge. High quality collections of very dense data, even at the level of individuals, can actually accelerate innovation.
Great. Thanks.
Mitali, just one point I want to add there. So I think AI has to be seen as a decision support tool, not a decision-making tool. So AI now, the AI that is happening now is enabling patients with more pointers, like Dr. Anurag said, that they don't need to memorize things, they don't need to memorize certain patterns. It is giving them information, right, which can be extracted out of data and giving them more time to process and spend time on where they should be spending. So we should not see AI as replacing any of the specialists wherever they're working. It is helping the pathologist. If we see it that way, then we will build very great AI solutions and will help the healthcare. If you want to replace the clinicians, then no, that's not what the goal of AI should be and is.
Mitali, just one more line. I borrowed from my 5 stock.
Yeah.
Doctors, AI will not replace doctors. Doctors who use AI will replace doctors who do not use AI.
Yeah. So absolutely right. And I think we are just dot on our time, but it has been a fascinating conversation. And I think I feel very optimistic that we will have a world-class healthcare system in the country. It's a true opportunity for all of us. And we could become a role model for many of the other countries who are not having that kind of resources as some of our Western counterparts. With this, I profusely thank Dr. Anurag and Nimisha. Thank you so much for making this event so lively and so informative. So thank you once again.